Welcome to Medica Nova Wellness Studio. I'm Dr. Angelika Maria Koch with your educational videos about optimal health and the most innovative and holistic approach to your well-being. In today's video, let's explore how you can manage and heal endometriosis with natural and effective therapeutic tools. Endometriosis is one of the most common health issues experienced among women and is also one of the leading causes of infertility. It's estimated that about 190 million women worldwide suffer from endometriosis. It's a very painful condition. The good news is that there are really great treatments out there from the orthodox or traditional medicine as well as from the complementary medicine field. And in this video, I want to share with you some very, very useful tips. So enjoy this video. To stay updated with my ongoing videos, I encourage you to subscribe to my channel, share and like it with your friends and families, and don't forget to click that bell as it notifies you every time I upload a new video. And thank you so much for your thumbs ups and your likes, as I do help the growth of my channel. Have a look at my website, medicanova.net, at the online academy, where you will find comprehensive, certified, university standard home study online courses in homeopathy, health and wellness coaching, mental health, and quantum healing, and so much more. While you're at the website, have a look at the wellness programs. Medica Nova offers one of the well-researched, most advanced cellular detox systems, as well as we really focus here on the microbiome, which is your bowel flora, and really nurturing and healing your digestive system, because that's usually where the whole thing starts to fall apart and diseases start to sort of thrive. As well, we started a 3-month holistic smoke and cessation program. So if you're interested in that, contact me at help@medicanova.net. So what is endometriosis? Well, in simple terms, it's a condition in which tissue similar to the lining of the uterus grows in other areas of the body. It should be in the uterus, but here it sort of moves around the body. Now, the female reproductive system includes the ovaries, the vagina, the uterus, fallopian tubes. And here this tissue starts to move around. So during a normal menstrual cycle, the ovaries make hormones which signal the lining of the uterus to thicken. And this is called the endometrium. It's the inner mucous lining of the uterus. So the endometrium builds up in preparation to receive a fertilized egg. So imagine it's like the body highest intelligence knows that, okay, we have to build a little nest. So we thicken, the tissue so the egg really is welcomed. Now, if the egg is never fertilized, then this leads to menstruation and the shedding of this lining. Now, for women with endometriosis, the lining tissue grows outside of the uterus. And this misplaced tissue responds to the hormones by thickening and shedding with every menstrual cycle. But however, here, this thick tissue, because it's outside of the uterus, really cannot leave via the vagina or just exit out of the body. So this endometrial flow is therefore trapped. And the body knows that something isn't working here, so it tells you, or you experience pain and an inflammation. Waking you up and say, hey, I need some help here. After a while, if this becomes a chronic condition, and unfortunately, women do suffer from endometriosis, not just for one menstrual cycle, but often for years, there can be adhesion, scar tissues, which sort of attach themselves to other parts of the organs. Now, it can even cause fallopian tube closure, and that can be even a leading cause for infertility. The endometrial tissue may grow around the ovaries, the fallopian tube, the back of the uterus, but also the intestines, or your bladder is affected here. Even your rectum So you can see a one-size-fits-all treatment plan is not very effective here. You have much more results when you know your individual symptomatology, right? If you know what is the main symptom, from your endometriosis, and that can be maybe the pain in the rectum while passing stool or excessive bleeding. And then find or create a treatment plan which works for you, and then you see results. Another endometriosis symptoms is the formation of called endometrioma, known as this dark reddish-brown cysts or fluid-filled sacs, which we often find on the ovaries. Of course, it affects fertility here as well. Women often experience abnormal bleeding here. It is not uncommon that women who have very painful periods also experience endometriosis, and therefore maybe have a challenge to get pregnant. There is no sort of cure for endometriosis, but various treatments are available. From the orthodox side, we have, of course, hormone therapies, medication options, but they also come with a truckload of side effects, with maybe long-term infertility issues even, and cancer. So if endometriosis symptoms become too severe, surgical procedures are necessary. And I'm not saying you shouldn't have it, because if you suffer, of course, please. But this video really focuses on the early stages of endometriosis and other options which maybe can prevent you to have a surgical procedure in the long run. Now, what are the symptoms? Painful periods, we call it dysmenorrhea, irregular periods, painful intercourse. Because, as I said, the colon is close by, you have maybe pain during a bowel movement, pain during urination. Absolutely excessive bleeding is one of the main symptoms here. You maybe also experience spotting or bleeding between your menstrual cycle. Often there is constipation involved. The whole digestive system, the whole colon system is affected here. Maybe nausea comes to mind here. Often we see abdominal bloatedness, right? It's like you feel like, oh my God, I feel like 6 months pregnant after eating. Others experience lower back pain, or the entire abdominal area, pelvic area is affected. Your joints may be affected. Your nerves may be playing up here. Because women with endometriosis, lose a lot of blood each month, they feel fatigued. It can be even chronic fatigue. And because of this experience of excessive pain, they feel depressed. There's anxiety involved, and also the susceptibility to infertility, which just adds to this whole pot of difficulties and challenges. It's like the quality of your life is seriously affected here. With many women, the progression of endometriosis is a slow process. It's not coming overnight here. It develops over many years. But each woman experiences a different range of pain, which also can make the diagnosis maybe a little bit difficult. The pain typically begins in the lower abdomen and intensified during the woman's menstrual cycle. But as the pain also becomes more severe, you maybe experience pain traveling down, the back of your leg. So it can be quite a complex situation, but it doesn't have to be. What are the causes or the risk factors? Well, often there's a genetic factor involved. So there was maybe some, among the women in your family, a predisposition to it. Maybe there was infertility already, or they say pregnancy at an older age. As I said, the menstrual flow is maybe backed up into the fallopian tubes, and the pelvic and abdominal cavities are therefore, particularly during the menstruation, are affected. There's another condition called Solomonic metaplasia, whereas the areas lining of the pelvic organs contain primitive cells that can grow into other forms of tissue, such as maybe endometrial cells. I also want to state that the direct transfer of endometrial tissue can happen during surgical procedures. For example, during cesarean, operation here. If there's an issue with the hormone balance and the immune system among women, that can be, a susceptibility here as well. The conventional treatments are usually based on pain medication, on hormonal treatments such as hormonal contraception or hormonal therapy. I'm not saying you shouldn't do it, because it does regulate the hormones and it slows down the growth of the endometrial implants and also decreases the menstrual flow. But if you keep doing this for longer than 5 years, there are side effects to be expected. And here we talk about ovarian, breast, and maybe endometrial cancer even. So it's very important that you get regular screenings. As I said, this video really focuses on the early stages of endometriosis. I had really great results with lifestyle changes, bringing in some supplements, homeopathic remedies, but also working more with the coaching approach here, cognitive behavioral therapy, right? A whole system here works here very well, and I'm sure I can help you a little bit here. So if you have any questions, contact Medica Nova at medicanova.net. If you're interested in a health consultation, either for yourself and or your children, contact me at Medica Nova at health@medicanova.net. Medica Nova is my practice for integrated and educational medicine. We offer a unique blend of natural and cutting-edge therapeutic tools from homeopathy, iridology, sclerology, systemic herbology, advanced biofeedback, and health and wellness coaching, and so much more. Book your appointment today. As already mentioned, endometriosis is a very difficult and a very challenging, painful condition. And needless to say, women, experience a lot of depression, anxiety, disappointment, that somehow they run from doctor to doctor and there's no one really out there who can understand them in the first place. Don't get me wrong, in the initial phases, doctors maybe say it's all in your head or you're just stressed out. And this woman on a monthly basis is lying on the floor, riddled with pain. But as you know, there's a mind-body connection. And in my experience as a healthcare practitioner, I see also there's a story behind the endometriosis, which often has to do with your femininity, your relationship to being a woman, your relationship to maternity, as a general topic. And here I want to share with you some food for thought, some metaphysical meaning, what maybe is triggering your endometrial symptoms, and invite you and welcome you to maybe review if that maybe applies to you or resonates in your heart. So according to Koch's references, endometriosis is the formation of fragments of mucous tissues outside of the uterine wall. We understand that. It is also related to an unconscious refusal of maternity. It often happens that the relationship I have or had with my mother, or the heritage she left me, either physical as well as emotional, is in conflict with what I am and the place I want to hold in this world. So if you grew up with a mother who wasn't very nurturing, or maybe didn't want you to have in the first place, right? For whatever circumstances and reason, that cellular behavior or memory is passed on to you, and you maybe now, being a grown-up woman, really question, do I actually want to pass on or experience the same, neglect or abandonment, and you start questioning. You're not quite clear if you want that child. I don't know how to position myself before this lady. We talk about your mother, who was so influential in my life. I'm afraid by expressing myself, I might agonize her even. Is it possible that my parents loved each other, but I deny this fact? The second chakra, your reproductive system, has really to do with the relationship towards yourself as well the relationship to others. Your creativity, your uterus is the hub of creativity. If I come from a so-called broken family, and don't get me wrong, most of us do, I may fear that the family I will offer my child won't be perfect and won't be even good enough. It is as if this child's nest, right, the thickening of the uterus lining, was somewhere else. It's outside the body. Not outside the body, outside the uterus, the organ. And can't suitably welcome it in my own home. Do I have any doubts about my spouse or us as a couple? Do I have any doubts about my spouse? Am I afraid that I or my spouse may go and see elsewhere, right? It's always outside where it should be. Do my aspirations and my life as a couple make me fear that a child will change everything in my life? Maybe I have to give up my job. What about that? I worked so hard for this career, this position, or I'm just about to get the promotion, which I worked for the last, 10 years for, and now I'm pregnant. What is going on? I doubt my capacity for being a good mother. Maybe I feel or sense that the home of this future child will be outside of my home. A lot of career women, have nannies or put their children into childcare, because they have to. But personally and emotionally feel a little bit not aligned with this whole thing. They really miss being with their children. That can be a factor, right? Because the nanny or the childcare person spends more time during the day than they do with their own children. It may also happen that I don't accept the world in which I live, or that I don't dare to be part of it. If I don't accept this world, how can I bring another being into it? I hear others saying, this world is too crazy right now, right? I mean, how can I even financially sort of support my child? Later on with the college even, it's impossible. Yet even before my birth, I chose to come into this world. I wonder why I have difficulty accepting myself as I am and channeling my creativity. As I said, the uterus is the hub, is the place, is the home of your creativity. Creativity can be bringing in life into the world, but also, can be creating a masterpiece of a painting or your next book or whatever you relate to your own being creative. I allow people to walk all over me and I swallow everything without saying a word. I feel I don't have the strengths, right? The uterus is a muscle, is a strength to stand up and assert myself, and I constantly experience failures. I become aggressive, for I know I'm preventing myself from achieving things because I have difficulty in focusing on my goals. So what would be the positive affirmation here? Something where you can, really start owning and really start saying and talking to yourself on a daily basis. So you change your cellular behavior, which is, of course, based on that you're aware of your relationship between the fears and the doubts and the uncertainty you have towards yourself as being a woman and the situation what you experience, and also accepting to openly express what you feel. Don't hold it back. I assert myself as an individual. I recognize who I am, and I no longer allow anyone to abuse me. Everyone will respect me, and I can thus flourish and let my creativity express itself. I want to invite you and welcome you to really take that into your heart. Ponder about it. Is there anything out there in your life, or the work situation, your spouse, your children, anything what affects your femininity? Because I do see it in my practice, very commonly that women do have, problems here. And why not address this too? Because you can take all the tablets under the sky if you don't address the actual cause, the core wound of the situation. If you want to explore more about yourself, your wellness vision, what motivates you, and how to apply your strengths in achieving the very best of you, contact Medica Nova Wellness Coaching at health@medicanova.net for your 3-month coaching program. I am coaching you to be well. Let's look at some natural treatment protocols here. Lifestyle changes are absolutely important because it's an inflammatory situation, which also includes a lot of pain. You will have to introduce an anti-inflammatory, healthy diet. So it is actually adamant you have to take out dairy, processed foods, refined sugars, caffeine, alcohol, carbs. Yes, it is a lot, but it will help you to be better, to heal yourself. Cut out all high estrogen foods. They should be eliminated because, of course, they just affect your hormonal system in a detrimental way here. Supplements, yes, they are helpful. Often when you go to your gynecologist, you may be offered a progesterone cream. Talk to your naturopath and healthcare practitioner about it. Because of this high inflammatory and pain experience, you want to bring in a lot of omegas like fish oil. Other herbs are vitex or milk thistle, which help for your liver. There's great research on pine bark. It's maritime pine bark. It's also pycnogenol, and it's used as a natural remedy to treat endometriosis. And research has shown that treatment with pycnogenol slowly but steadily reduced endometriosis symptoms. So that's something you maybe want to explore. Because your nervous system is involved, vitamin B complex on a daily basis, I think 50 milligrams would be suggested here as well. In the beginning of this video, I mentioned to you that each woman experiences a wide range of symptoms, but also individualized symptoms. And here homeopathic remedies are a godsend here because they're not just a one-size-fits-all remedy, but really go into the specific symptoms here, and then you see better results. The primary aim of homeopathic remedies for endometriosis is to provide symptomatic relief, right? We can't cure it altogether, but we can do a lot here. And in the process, they also treat related issues. Maybe is the infertility here addressed, arising from the inflammation, the adhesions, and the scarring within the fallopian tubes. So a lot can be done here. Many homeopaths may prescribe standard indicated homeopathic remedies, which I share with you here for endometriosis, and I wholeheartedly verify here, for example, Dr. Vikas Sharma's references, which I share with you here as well. Yet be aware that an effective treatment protocol can only be established according to to the individual presented case notes. And here you will need a professional homeopath. If you need more guidelines, you know how to take these remedies, contact Medica Nova at health@medicanova.net and book your appointments. I'm very happy to support you and help you here. Most of the remedies which I share with you, you are actually, you can purchase online or in your local health food store. So it isn't complicated, it is affordable, but you need education. And that's here the key, right? Education is prime, you know, not just buy a remedy, but know why you're doing this in the first place. So if you experience endometriosis with painful periods, we call it dysmenorrhea, I suggest 2 remedies. One is called xanthoxylum. I always print it underneath here so you see that writing and the pronunciation here. The potency is 30. That means there's a number behind each name of the remedy, and it means the strengths, and here I would say 30C would be appropriate. Another remedy is called Simicifuga racemosa. They're Latin names, but it's not too difficult. So xanthoxylum is best suited for women who have very painful periods, excruciating pain. And that can be in the pelvis, but also down in the back, the thighs, the legs, all of that. The menses is very profuse, very exhausting, of course. Whereas Simicifuga also, displays these strong pains, but they're almost like of an electric-like sharp pains. They're very sudden, right? And they hit you. There can be bearing down pains in the lower abdomen, the uterine regions, lower back as well. But the nature of the pain is very darting, and it can be even from hip to hip. So if you experience that, think about Simicifuga racemosa. Dosage plan, of course, it's difficult to say in this video because you have to take the case notes. But hey, if you want to try it, it's 1 tablet, I would say 3 times a day. Try it out for a week or 10 days, see where it's going here. But always consult with your healthcare practitioner and homeopath here. If you just experience pelvic pain in general, I would say the remedy is Sabina. CPO officinalis is one of the main remedies here, as well as pulsatilla nigricans. 30 potency as well would be really a great choice. So with Sabina, you almost have colicky or labor-like pains. Right? It's not just a general pain, it's labor-like pains. It means it comes and there is this spasm and you maybe crouch down, it's really strong. That's the nature of what we are looking here, as well as pain in the small of the back, maybe the sacrum and the pubis are involved here as well. CPO officinalis, on the other hand, they have a lot of bearing down pain, so you feel like even with any menses that you feel as almost as if everything comes out between your legs. It's this kind of bearing down, dragging feeling. There's a griping, a stitching, a clutching pain in the pelvis. Pulsatilla nigricans, it's a flower. Again, we experience pain during the periods. Often the women feel very chilly and cold, restlessness, tossing in bed, and their personality is very weepy. It's in need of comfort, right? It differentiates it with other remedies. It's a very sensitive personality. We mentioned that others experience maybe pain during intercourse. That's your main experience of having endometriosis. Again, we have beautiful 2 remedies called CPO officinalis 30 or Platina metallicum 30. We call it also dyspareunia, the pain during intercourse. I would say, both remedies are involved here, but to differentiate it, CPO officinalis is based on the cuttlefish actually. Here the sexual libido is very low, it's diminished. The woman who, maybe goes through a menopause or has endometriosis really isn't interested anymore in sexual intercourse because it's painful anyway. So there is a reduction of the libido. Whereas in Platina, metallicum, it's an increased sexual desire, right? So that gives you the differentiation. And as I said, I'm happy to help here. We talked about that some women experience more the rectal symptoms, that when you pass stool, suddenly you have this really big pain in your rectum. Nux vomica, ammonium muriaticum, and lachesis are great remedies here. Nux vomica is very prescribed in situation when you pass the stool, but it's ineffectual. You feel like, oh my God, there's still something in there, right? Let's say it like that. And you have the urge, but there's this rectal pain, and it's unsatisfactory. You feel like it's constipation. Talk about frankly here, right? Ammonium muriaticum or lachesis, again, suited remedies here for endometriosis, but here often when there is a lot of bleeding from the rectum during the menses, right? So you have to differentiate, and when you find the matching remedies, well, you will be very happy that you know about this information. We talked about urinary troubles, right? Some women just experience the pain when they go to the bathroom and or maybe have frequent urination, but and maybe get confused. Do I have a UTI? Do I have a urinary infection here, right? So that's why the diagnosis becomes, in the beginning, becomes a little bit dubious. Again, Sepia officinalis and Natrium muriaticum, I can highly recommend here. Sepia officinalis, particularly when you have an urinary urgency or frequency. There's again this bearing down sensation in the pubic region, low sex drive, libido definitely down. But also pain while passing urine from endometriosis. Lesions also indicates this remedy, Sepia officinalis. Pain in the bladder, maybe an aching or dull pain, even a burning nature. That's why it can be confused with the UTI during the menses, also points to this remedy. Natrium muriaticum, on the other hand, is more effective when you see bleeding from the urinary bladder, which appears simultaneously with the menses. All can be rectified, right? You don't need necessarily hormonal therapy in order to meet this challenge. So I hope that this video gave you insights, encouragement, and an invitation to look for more natural solutions. If you want to know more about these treatments, what Medica Nova offers, as well as the guidelines, how to use these remedies, contact me at medicanova.net, or my email is health@medicanova.net. Lastly, have a look at my website, medicanova.net, at the online academy, where you will find comprehensive certified home study online courses. For example, if you always wanted to learn about homeopathy, it's a practical guide for the whole family and beyond, so you have more confidence how to help your loved ones as well as yourself. We also offer a great course called Thriving with Homeopathy for Birthing Life. This is indicated for doulas, midwives, childbirth educators, nurses, and also mothers-to-be. If you wanted to know about more health and wellness coaching, mental health, what to do here, what is depression, anxiety, Alzheimer's, what solutions do we have, as well as quantum healing. I also have a book called The Dance of Your Core Healing, Transforming Your Mind, Body and Soul in the New World. You also find that on my website. And hey, always reach out. And I'm here for you. don't get depleted or disillusioned that there's nobody out there to help you. I'm here for you. So till next time, much love. Take care.